This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today. Welcome to the Global Men's Wellness. I'm Dr. Judson Brandeis, and I'm so glad you're here. Let's talk about something that over 1 in 10 Americans will experience in their lifetime, but few want to discuss: kidney stones. You may think of them as a painful inconvenience, but in reality, kidney stone disease is a chronic, recurrent condition. And while passing a stone might feel like the end of the problem, for many, it's just the beginning. Today's episode focuses not on crisis management, but on long-term prevention. What causes kidney stones? Who's most at risk? And most importantly, how do we stop them from coming back? What are kidney stones? Kidney stones form when minerals and salts in the urine, like calcium, oxalate, or uric acid, become too concentrated and crystallize. Imagine your kidneys as a water filtration system. When fluid levels are low or mineral levels are high, crystals can form and clump together. Over time, they can grow large enough to block the flow of urine and cause severe pain. There are different types of stones, with calcium oxalate being the most common. Others include uric acid, struvite, and cystine stones. Each has different causes and treatment strategies. How do they form? Dehydration is a major factor. When urine is too concentrated, crystals are more likely to form. Diet also plays a role. High sodium increases calcium excretion. Low citrate levels remove a natural inhibitor of stone formation. Animal protein can increase acid load, while too little calcium ironically increases oxalate absorption. It's like plumbing. If you're not flushing the system properly, or if the water chemistry is off, buildup is inevitable. Is prevention proven? Absolutely. The AUA guideline, built on systematic reviews of over 150 studies, recommends a thorough evaluation for anyone with recurrent stones. This includes dietary and medical history, blood and urine tests, and when possible, stone analysis. The goal is to pinpoint metabolic abnormalities like high urinary calcium, oxalate, or uric acid and address them directly. Therapies include dietary changes and medications like thiazide diuretics for calcium stones, potassium citrate for low urinary citrate, and allopurinol for uric acid-related stones. These interventions are proven to reduce recurrence. Why isn't everyone being treated? Unfortunately, many patients never get past emergency care. Once the stone is passed or removed, the urgency fades, and the long-term strategy is forgotten. There's also widespread misinformation. Patients are told to avoid calcium, when in fact adequate calcium intake is protective. Others don't realize how much sodium contributes to the problem. Even among healthcare providers, there's inconsistency in prevention practices. Insurance coverage for follow-up tests or dietary consults may be limited, and some providers don't know that tailored prevention can cut stone risk by over half. What do patients experience? Physically, a stone episode can feel like intense stabbing pain in the back or side, often radiating to the groin. Nausea, blood in urine, and frequent urination are common. But the emotional toll is also high. Fear of recurrence can be paralyzing. Prevention strategies can empower patients. For many, it starts with a 24-hour urine test to analyze volume, pH, and mineral content. From there, adjustments are made, increasing water intake, moderating sodium, managing protein, and sometimes adding medication. It's not about perfection, it's about reducing risk. And success means fewer ER visits, fewer surgeries, and better quality of life. Personalized urologic care. One-size-fits-all advice doesn't work. A patient with calcium stones and high urinary calcium needs different care than someone with uric acid stones and low urine pH. That's why personalized treatment is key. As a urologist, I base treatment on lab results, stone composition, diet, and lifestyle. We look at trends over time, not just snapshots. We monitor progress with repeat testing, because what gets measured gets managed. I also consider patient goals. How aggressive do they want to be? What changes are sustainable? How do we balance medical management with lifestyle realities? How effective is it? Extremely. In motivated patients, recurrence rates drop dramatically. In one study, high fluid intake alone reduced recurrence by over 50%. Add targeted medication, and results improve further. For example, potassium citrate therapy can help alkalinize the urine and prevent both calcium and uric acid stones. Thiazides can lower urinary calcium levels. Even cysteine stones, the most difficult to manage, can be controlled with thiol-binding agents and alkalinization. These aren't hypothetical gains, they're real improvements in day-to-day living. The future of kidney stone management. We're moving toward more precise care, using genetic data, better imaging, and wearable technology to track hydration and urinary metrics in real time. Artificial intelligence could soon assist in pattern recognition, helping predict who's at risk and when. Telemedicine allows for easier follow-ups and access to specialists, and as public awareness grows, we're slowly shifting from reaction to prevention. Why I do this work? Because no one should suffer alone or in cycles when better options exist. I've met patients who lost work, relationships, and joy because of repeat stone episodes. I've also seen the transformation when prevention clicks, when the cycle is broken and life feels normal again. There is a better way. Kidney stones don't have to be a life sentence. With the right information, the right support, and a plan that fits, we can change the story from crisis to control. Thanks for joining me on the Global Men's Wellness. I'm Dr. Judson Brandeis. Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.